Welcome back, everyone. Time to get straight to Chief Meteorologist Steve Caparizzo for this week's Pet Connection Extra. Steve.
Thank you, Christina. Veterinary medicine is amazing. It's much like medicine for people. There are specialists you can see, like cardiologists, oncologists, dermatologists, ophthalmologists, and orthopedics. The work they do is amazing. It can improve the quality of life for your pet tremendously. Dr. Tom Bowersox is an orthopedic surgeon. He has worked on Hudson and Pearl, the two pit bull puppies, and even one of my dogs. At some point in your pet's life, a leg can be injured for any number of reasons. But just like a person, it can be fixed.
The most common thing that I see is a torn cruciate ligament, and in dogs we call it a CCL, which is equivalent to what people are familiar with as an ACL in their own knee.
With a leg injury, time is of the essence. Otherwise, you could do more damage.
It's so common that I'll see dogs that have been lame for 3, 4, 6 months before they seek the attention of a specialist or another opinion. And by then, arthritis has developed in the leg, and although surgery is still beneficial, not nearly as beneficial as it might have been at 3 or 4 weeks rather than 6 or 8 months.
How involved is the surgery?
There are certain practices in the country that scope every dog knee that they do, but in terms of the repair is still beyond that. The repair is more of an open approach, and there are 3 or 4 different major repairs, but the most common one that a specialist is doing these days is called a TPLO. The premise of the surgery is we want to change the angle at the top of the tibia. So what we've done in essence is cut this bone and rock the whole bone caudally or backwards, and that changes the angle and makes it flatter so that the two bones pivot on one another rather than sliding back and forth. In my lifetime, the TPLO is the most successful repair that we've had for a cruciate ligament. I would put it close to 90 to 95% successful, which is amazing for really any surgery, and especially in a dog.
Despite size, all pets are susceptible to injuries.
Knee injuries are sort of universal. Anything from little dachshunds and Pomeranians to German Shepherds and Newfoundlands. And they all can tear their cruciate ligament, but I think the dogs I see in a specialty field are the larger dogs, so anything 40 pounds and up. If your dog is a couch potato with you all winter long, don't start throwing a Frisbee and a ball for them the first day it's nice out. They need to exercise and work up and get in shape again just like we do.
Thanks, Dr. Tom. A good rule of thumb, if your dog or cat injures its leg and is limping for a day or two, don't worry too much if they're not in pain. If the limp gets worse or lasts longer, it's time to see your veterinarian. And this may mean seeing a specialist like Dr. Bowersox to help fix that problem. Back to you, Christina.
All right, Kat, thanks so much.